Hi, everyone. I'm Kelly Madey, and I work with Weatherby Healthcare. And today, once again, we have joining us Dr. Nicholas Kusnezov. He is a board-certified orthopedic surgeon. He is a decorated career in the U.S. military and also actively engages in graduate medical education and clinical research. Dr. Kusnezov, thank you so much for joining us again today.
Very happy to be here. Thank you for having me, Kelly.
Well, you are one of our contributors on our Weatherby Healthcare blog. You bring your expertise to a lot of great posts. And today we're excited to talk about one of your posts on how to prepare for a locum tenens assignment. So how long have you been working in locum tenens?
Thank you, Kelly. So I've actually been working locum tenens assignments for a number of years now, and I've had enough foresight really to set up my locum assignments so that I could essentially transition to locums immediately after completing residency. So on a side note, I'm a big proponent of maintaining your skills after residency, and I think it's especially important for physicians who don't immediately pursue a fellowship and for those who might transition to a more remote and or slower paced general practice.
Now that you've been working locums for some time, how do you prepare for an assignment now compared to when you first started?
So when I first started, it really felt like the first day of school. So I overpacked, showed up super early, took notes on everything from hospital layout to door codes to contact numbers. And I think after a while, you really learn to isolate and extract the important information. Fast forward a few years now, and there's really much less, in fact, very little preparation involved. Because while each new assignment is slightly different, the orientation days are all structured similarly. And I have an idea of which locations I need to know critically within the hospital, which door codes are important, who the important contacts are, and how I can find them if I need to. So I think it really becomes second nature.
And you mentioned that for new assignments, I know now it's a little bit different since you've been doing it, but for new assignments, you like to arrive a day early. How does that help you?
So most of the time, you'll arrive the day or night before you're scheduled to start working, just to facilitate you showing up on time to your first shift. But I would say that the day before the big game, you want to go to the field and run some plays. And I think showing up early really serves the purpose to assuage anxiety because you figure out the lay of the land. And by doing so, you really eliminate this unnecessary, sometimes subconscious stressor, showing up into a foreign environment and not knowing where to go. So I think that by contributing to your own comfort, you're outwardly more present and focused and have the opportunity to really make the best impression at your new assignment. Conversely, being flustered and distracted will detract from your experience there as well as the facility's impression of you.
Yeah, and you also mentioned the importance of verifying your schedule before you go to your assignment. What can happen if you don't verify your schedule prior to arrival?
Sure. So I have, again, a lot of experience with this, having been in locums for a number of years now. And you have to understand that, especially if you're new to this, that there are a lot of middlemen in scheduling. So you might get presented with dates from the locum company, but remember that the locums agent is working with a point of contact in the hospital, who may be working with a scheduler for the department, who may be gathering dates from individual members of that department. So when you have this many links in the chain, scheduling changes are frequent, and these may or may not be relayed to you in a timely manner, and sometimes if at all. So the good news is that once you sign, having committed to certain dates, the company and the hospital are generally obligated to pay you for your time, whether or not the hospital is now, say, double booked or overcovered because they've made changes and didn't forward that along to you. So for instance, some time ago, I was en route to an assignment scheduled to start the next day, and I was in the airport. I got contacted by the coordinator at the hospital letting me know that they were so excited that I would be starting in a few days. So I immediately reached out to the locum company, and this issue was resolved literally within 30 minutes. So in my opinion, it really pays to have someone experienced and well-connected in your corner. I like to show up, work, and take care of patients, and I don't like to consume my time with troubleshooting scheduling, especially schedules that I've already committed to. Moreover, on the flip side, there may be last-minute holes in coverage, and by reaching out to confirm your schedule ahead of time, you may be given the opportunity to cover a longer or perhaps a separate shift in addition to what you've already committed to covering.
So we've arrived a day early. We verified our schedule for all of those great reasons. and now it's up to making the first impression. Why is it good that your first impression is so important?
Sure. And the merits to first impression are a little bit inherent, but obviously a good first impression, in my opinion, is not only paramount to starting off your assignment on the right foot, but to being asked back. So the first impression will often set the tone for the rest of your assignment. Leaving a good impression will leave people with the feeling that you're a professional, that you're approachable, that you're easy to work with. You'll often meet a number of support staff and personnel that may not ever see you face to face again. And so leaving them with a good impression is really essential toward greasing the skids for future interactions. And remember that even as a locum, you'll be representing that institution. So they want a physician who will carry themselves as a professional.
And you also talk about how it's important to find out more, not just the where and when you're going to be working, but why they need you and what that facility is hoping you will accomplish while you're there. Can you tell us a little bit more about that?
Sure. So at a minimum, as you said, Kelly, it's important to know where and when you're working, right? But on a level well above that, understanding why a facility needs you, for how long, and what they're hoping to accomplish by having you work there will give you the opportunity to really align your goals and have the most positive impact on patient care. And as one, again, pertinent example, if a facility is working to build a trauma program, for instance, they'll be interested in growing the volume of trauma patients that they accept and assume the care of, and sometimes the complexity of the trauma patients as well. And as a locum physician working for this facility, you want to contribute to this impetus and avoid working counteractively by, say, deferring consults or transferring patients unnecessarily. Now, it may be that you're not comfortable with the level of care that you're expected to provide, in which case the facility may not be a good fit for you. But conversely, if you're looking to take on more high acuity trauma and potentially sicker, more complicated patients, but the facility is less equipped to do so, say a lower level 3, you would want to avoid taking on care of these patients and potentially overburdening the facility. So again, despite kind of the transient nature of locums, by aligning your efforts with the facility's needs, you can really work synergistically toward optimizing patient care.
Well, I think all of the tips that you've shared with us today will help anyone who, whether it's their next assignment or their first locum tenens assignment, get that seamless start they're looking for. Dr. Kusnezov, thank you so much for joining us again, and we hope you have a great day.
Absolutely. It was a pleasure, Kelly. Thank you.